I'm Dr. David Satcher. I was the 16th Surgeon General of the United States, and prior to that had served as director of the CDC. It's important to know where we fit in the global picture. And the United States is not doing well when it comes to supporting breastfeeding. In fact, we come in last among major industrial countries. As Surgeon General, I worked with the Office of Women's Health to release the blueprint for breastfeeding. And I think what we felt was that it was something that was needed because we saw problems with the babies and parents. We saw problems with hospitals, saw problems with physicians. In all of these areas, we saw opportunities for improvement. We saw problems with the workplace. Some countries like Norway, which has the best breastfeeding rate, will support women up to 6 months parental leave to breastfeed, sometimes up to 9 months. So that's the best example. And it's interesting, and I didn't say this earlier, but Norway has one of the lowest mortality rates among children under the age of 5 in the world. Many of the disparities in our community we know are reduced, if you will, by breastfeeding. For example, when you say that childhood obesity decreases with breastfeeding, major problem in our community. Asthma, major problem in our community, and that risk of asthma is reduced by breastfeeding. And many of the other things we've mentioned in terms of infectious diseases and things like that. For baby and mother, those things are reduced by breastfeeding. We had something we call the baby-friendly hospital. I remember going to Providence, Rhode Island, when we first released the blueprint because of a hospital that had been identified as an ideal baby-friendly hospital, where every new mother was supported in beginning breastfeeding. At the Satcher Health Leadership Institute, we have tried to develop metaphors to help us teach leadership skills and to share leadership skills and principles with people in all 3 of our leadership development program. And some of them include things like leadership is a team sport. Leadership is not position dependent. Now, I'm really big on the team sport one because I feel very, very good about what teams can do. I think the tradition of breastfeeding is a really good example of where we need teamwork. So it would make a lot of sense. It would be a good investment for us to significantly enhance our support for breastfeeding.